This is part 4 of the interesting case of the relationship of the ankle, the hip, and the pelvis. And after treating those areas, I worked on a restriction in his forearm on the right. He was a tennis player for many years, and we restored superior glide of the radius. And I think I'll focus this on the skeleton just so it's not a boring boring thing. And after that, I worked on the first rib, which was restricted on the right side, and also the right acromioclavicular joint, and those released rather readily. Prior to that, springing on the cervicothoracic junction produced spasm and pain in the left pectoral region, and now it no longer behaves in that manner. I found an oblique restriction in the occipito-atlantal, where the head and the first vertebrae in the neck connect, as though he was looking to the right and up. So I could not create oblique mobility, springing the occiput downward to the right. After treating the neck, I had him stand up and walk around, and his spontaneous comments were very interesting. And if you could share with us what you felt.
When I stood up, I immediately felt a difference in my balance. I actually got goosebumps and felt an entire change in my sensory perception. I felt as though I could breathe better, not only through my sinuses but deep down into my lungs and ribs, which I haven't felt for a long time. My right side, I've always felt restricted on my right side. I felt like I was loaded on my right foot much better, and now sitting, doing this video, I actually feel like I can actually put weight on the right side of my pelvis. So I now have, I typically feel as though I'm kind of bent to the left and shifted, and now I feel like my weight is much more evenly distributed, and I can actually feel my right sit bone and feel much more centered. And even just saying this, I can hear my voice in my head much differently than I have for years.
That's interesting. I wouldn't even know how to speculate. What would cause that. It's, I use the word reflexively driven, which is a good term for I don't know.
It's bizarre to me. I can hear
your
my
phonation
voice
is different.
Yeah, completely different.
Could it be that the ear drained a little bit? Could it be that the sinuses open up a little bit? Who knows? I mean, it's just,
incredible.
You could get 10 different answers for it, but the bottom line would be, here's a theory, here's another theory. I don't think we know these things, but it sounds very appropriate. It sounds like restoring your body in the manner in which it was designed. You made a comment that you also felt like in standing you were finally putting weight appropriately in the right foot. Is that how you said that?
Yep.
So whatever it is, I think it's a very positive effect, and I think it undergirds the value of a whole body reflex manual therapy intervention to articular and neurological structures in a open-ended approach, not forcing your body into a paradigm, but rather letting your body speak to itself and finding what things seem to be aberrant from your basic body template. And there are times when someone doesn't need a whole body approach, and there's times when somebody does, So I think the wisdom is to know the difference and try to discern what's the most appropriate care for the individual. And I was not optimistic when I read your history. I was very concerned about seeing you. I thought I was ready to give you the lecture of sometimes we help by helping you understand what your body's doing, but that intervention may not be helpful, but I feel very differently about that now, and I'm sincerely excited about what your body is doing. I'll see you again tomorrow, and you have to take off and go lecture somewhere else. And we may have a follow-up down the road, but I think that we are off to a good start.
I 100% agree. I think your approach and the general approach to not just go to the symptom, but look around the body to find out what the body's smarter than we are. So when we can have good ways to look for clues, the clues tell us where we should treat versus the always go to the symptom, and it's
Nice.
amazing what can eventuate. So I really appreciate it.
Nice. And you know, you had surgery for your appendix, so sometimes, you know, the body needs our intervention that may have more wisdom. But on the other hand, in matters like this, could you rephrase that and state the body is smarter than clinicians?
Yeah, it is.
Say it.
It is. The body is definitely smarter than clinicians, and it's funny how we always keep trying to be smarter than the body, but if we just step back and let the body direct us and keep our eyes open and keep learning, then we will eventually be able to, you know, help ourselves and keep learning, because the body's smarter than we are.
Nice. Well, that encapsulates my philosophy of evaluation. Thanks very much.